Okay, so I am going to discuss identification of the thoracic spinous process. So first of all, it is the most reliable method, and it starts with the localization of T1. This is the location. It is all the spinous process are already marked, and this is the location of your T1. But how to identify T1? So for the identification of T1 or cervico-thoracic junction, first of all you have to make a fist like this, and then place it underneath. So you have to place the fist just anterior to the manubrium sternum, and then place your palpating finger over the presumed location of T1. Suppose it may be your T7, C7 or T1. For differentiation, just place your palpating finger pad over the presumed anatomical location of T1, and then apply the pressure from the manubrium sternum or over the manubrium sternum. At same time, you have to appreciate the motion or try to identify the bony projection which is coming out. So this is the projection which is little bit moving. So by this method we can identify the location of T1. The second thing, the location of transfer process. So again the same rule, you have to place the one index finger width on the lower margin of T1, and then again the complete length of the finger. I am using this length. I should use the complete length, but I have already compared the patient index finger with my finger. So the length of the patient is almost, means one phalanx is less. So according to the patient index finger length, I have marked over here, and I can first, you have to apply a gentle pressure and try to identify the location of T1 transfer process. Again, it has its own importance because the orientation of the trapezius, the oblique fiber and middle trapezius, basically upper trapezius, it is the junction between the upper and middle trapezius. So here you can even feel the transfer process, and if you shift your uh, palpating finger pad little bit more laterally, so you can also feel very easily the fast rate. Okay. So now come to the palpation of the rest of the spinous process. So I have already marked C2. Then slide your finger pad inferiorly and push it obliquely or cyclically. Means it should be, your palpating direction of palpation should be oblique, because the orientation of the thoracic spine is almost, it is inclined about the 70 degree. So according to the projection of the spinous process, you have to apply pressure and feel the bony projection. So this is the location of C2. Again slide it down, apply, repeat the same procedure, and you can palpate the next spinous process, that is your T3, and again you have to apply oblique pressure. This is your T4, slide it down, apply oblique pressure, and again identify the bony projection, and this is your T5. So rest of the vertebra or spinous process of the thoracic vertebra can be palpated with this method, and this is the most reliable method for palpation of the thoracic spine. Yes, sir.